Okay, in this part, we are going to talk about movement principles. We'll break this into different sections. We'll do an introductory section, we'll discuss some principles of exercise, and then we'll go over the American College of Sports Medicine guidelines. So just remember, nothing happens until something moves, Albert Einstein once said. Really, when we think about exercise, we want you guys to just really own that exercise is medicine and oftentimes probably the best prescription for our patients. We want to give them the gift of movement so that they can feel better and feel like they can function in their daily life and also participate in recreational things and social activities to really address the whole human that's in front of us. So what is movement? It's an act of changing physical location or position or having this changed. So it's just about everything, right? It's whether we're walking or playing, even when we're sleeping, right? If you think about REM sleeping, our eyes are still moving. This is really important for our clients and our analysis of movement and how good we are at analyzing movement really will help you with those building blocks to designing an effective treatment. Make sure that you have the ability to really truly assess those movement patterns. And if you're struggling with that a little bit, there's lots of resources out there. Talk with some of your professors, get with small study groups, really try to analyze how people move and start to question why, and then start to create a story for yourself and for your patients so that you can better identify the why behind perhaps that movement pattern that's being done. We're going to teach you to challenge yourselves and we're going to consistently challenge you to try to decipher why something is happening, but then also start to come up with a really, truly effective program for them. When you think about movement, we want you to always think about movement really is dynamic, it's fluid, and it's synchronized. So when you're watching someone, you might not only be looking at the mobility of it, but you're looking at their stability and their skill level. We really want efficient movement. So if you think about someone that you've seen that doesn't move efficiently, so if you think about a novice athlete versus an elite athlete, those are kind of the easiest descriptions to come to think about. But we can also think about someone who's had a neurological insult, so someone that has had a stroke is not moving as efficiently as they used to, and there isn't that balance between mobility and stability. Oftentimes with pain or dysfunction, that's what happens as well, and so our person can't execute the skill as well as they should or could have. When we start to see compensations and we start to see other strategies that our bodies are using, this is when we start to see probably increased wear and tear on our bodies, our joints, and our tissues. So an example would be looking at someone that comes in with a rotator cuff pathology. And we want to look at all of the different ways in which that person is complaining of pain. So we want to look at the positions they might be in, the environment, other parts of the body that come to play. So maybe their hips are so tight that they're in a forward head posture that they're not moving very well. So we're going to look at all of that. We're going to understand to get back to that synchronized, dynamic, fluid movement, we're going to have to address the whole body. Just a reminder that when we design our program, we're going to think about the effects of gravity onto that area, and we might do things to minimize that body weight coming into the ground. So, right, there's body weight supported treadmill training. You might put them in a pool, that kind of thing. We're going to think about reaction forces and how does someone actually deal with the ground reaction force. So everything changes when the foot hits the ground. If you have a really good gait analysis and you're able to do that, you understand that people that really absorb forces really well versus people that don't. This can be attributed into our upper extremity as well, right? So you think about a football player who maybe has force going through their upper body and their upper extremities. It would be the same type of thing and same type of phenomenon. Mass, I mean, look at the picture right here. Think about the two differences between those people, especially you think about big guy already has some braces around his knees and that mass is definitely affecting him that way. So when you're thinking about that, we want to think, how does our body accept the forces in relationship to the mass that we have? And then momentum, this is probably one of the most exciting arenas. This is where people find challenge and find fun when you design your rehab program for them. When you think about your influences on your intervention, it's not just what you found in your objective. I want you to really take a look at your whole client or your whole patient. So what is their current state? Are they well hydrated? Are they coming in motivated? Are they coming in with all these positive intrinsic and extrinsic factors? Or are they stressed to the max, not sleeping, fear, worry, anxiousness? Are they depressed because they're hurt? There's signs of overtraining, right? So we can tell that maybe even sometimes we're doing good, we're doing a great job, and then we have someone come in and they they can't handle as much of the stress that you've put on them. They really are starting to maybe even have some swelling associated with that. So that just utter fatigue level, like they can't actually recover well. So you want to think about that. We might think about a client that did heavy legs right before they came in to see you, and now they're so sore that they can't get through anything that you want to. So we might have to adapt our program to just create more of that pumping action, work some of that muscle soreness out, and then even think about monitoring our manual therapy interventions. This is just a great slide just to remind you we're all individuals and we have a lot of components that come into play for us. But when we think about our performance, we want to think about diet, hydration, movement, rest and recovery, and then the psychology behind it. So are we having some significant psychosocial things that we might have to deal with? And remember, you guys are the great motivators. So keep helping your patient understand and navigate that medical world. When you're designing it, really make sure that you are asking yourself, can your patient handle what you're giving them? Are you demanding too much? Have you reached too far? I think of a specific therapist that I worked with, first year out, and consistently we looked at her programming. She was always choosing what should happen 3 sessions later, and just expecting way too much from her client and her patient. And so we had to really kind of hone in on why she was doing that. She felt like she was doing a disservice, that they weren't getting enough out of it. And so sometimes even the simple movements can be hard when someone actually really needs it. Is your patient engaged? Have you guys ever watched, or did you ever prescribe exercises and the patient was bored out of their mind? Guys, that's not enjoyable, and we're not actually doing the best by our profession by doing that. So make sure we're representing well and we're using our big brains to make sure we're doing a great thing for our patients. And then come back to, are you compromising their mobility or their arthrokinematics? Are you compromising the way in which the body should move just to fulfill the exercise prescription? So you might have this great exercise and you really want it and you just know it's going to work and it's going to be awesome. And the patient just looks terrible doing it, but we're not adjusting because we want it to look good. So make sure we're always monitoring and adjusting. Okay, so really awesome thing is if you have success, right, throughout your program, if your patient actually starts to enjoy it, there's a part in your brain, the basal ganglia, actually activates more and more effectively and efficiently because of that enjoyment. So if you're relating to their goals, if you're having a good time, if you're constantly challenging them, those are all things that are going to cause that positive gain to come from the exercises that you're prescribing. It all starts with the art of listening. So just understand that you guys, we might have everything we want to say and everything we want to do, but a lot of times we just need to listen. They will tell you everything that they need to do or that needs to happen if you do a thorough subjective examination, and if you can use some of that positive feed forward and some of those positive interviewing skills to help your patient buy into your plan of care. And then lastly, what are the essentials of your plan? How are you going to design a really good plan of care? Well, what we just talked about, you're going to start with a really good subjective history where you're trying to gain knowledge. You're not just asking checklist items and questions. You're really trying to gain insight into the why is this happening and how am I going to solve this problem. I want you to think about you're the detective of the body, and you can be. So own that and really cherish that. You now can really help a lot of people with that. You have to identify not only what they're telling you their goals are, but you have to probably identify what their needs are. So I think about this with a young onset people with Parkinson's disease is they'll come in and they're still working. So of course they want their work to get better and they want all of that. But then need-wise, when I look and I analyze how they get in and out of a car and how they get in and out of a bed, that's already changing. So we need to address that and fix that, even though they might not come in and say that's one of their goals. You need to establish what level of health and what level of exercise fitness they're at so that you can really design a program that's going to challenge them in the appropriate way. Examine those skills, so meaning task analysis. Analyze the tasks that they're coming and telling you that are hard. Then you can now have a foundation to actually make an exercise program really efficient and effective. You need to think about local. So you're going to think locally. So if I come in, I have a shoulder pathology, manual muscle test, and I figure out your supraspinatus really isn't working, but it's because of scapular dyskinesis. Well, now I understand like your scapula isn't in the right position, so your supraspinatus isn't in the right position. But because of lack of use for so long, your supraspinatus has gotten sore. So I might do a V-up, really, where I'm saying, okay, I'm going to bias my supraspinatus. But I looked at your whole posture. You're standing, you have tight hip flexors. So even in standing, you look kind of junky. It doesn't really look good. So I might put you in a tall kneel position because now I'm opening up your hip flexors and I'm still challenging it. So I'm acting locally and thinking globally. Keep that at the forefront of your mind. Integrate that into your decision-making process. Integrate that into that program for your patient, and you guys are going to do really well. Great job on section 1. And next time in section 2, we'll dive a little bit deeper into global and local movements and some different principles of exercise.